Hello, everyone. My name is Gabriel Arroyo, and I'm a licensed marriage and family therapist located in Southern California. In today's interview with our series Psych in Real Life, we're interviewing registered nurses Robert and Katrina, and they're going to talk about how they feel mental health plays a role in medical treatment and prognosis. If you're new to our channel, be sure to subscribe to stay up to date with our weekly videos on mental health related topics and helpful coping skills for you to apply in your own everyday lives. All right, we are in our newest video of Psych in Real Life, and we have Robert and Katrina here with us. Robert and Katrina, do you mind introducing yourselves for us, please?
Okay. Hello. So I'm Katrina, and I am a registered nurse, and I work in a hematology and oncology unit, meaning there are kids that have blood disorders and other various types of cancer. And I've been a nurse for about 3 years now. Just about as much as Robert, actually.
Yeah. We actually went to the same school together. Hi, I'm Robert. I am a registered nurse as well. I work in a children's hospital, specifically acute care pediatrics. For the adults out there, it's just pretty much a medical surgical unit, but for kids. Been about a nurse for three years.
Awesome. So you're both RNs and you both work with kids. What got you into the field of wanting to become nurses?
So I know for me as a kid, my mom was actually a nurse, so that's kind of what influenced me. I just remember like days where my dad would have to drop me off at the hospital, and I would just wait in the lounge room until my mom could drive me to school. So I spent a lot of time like just spending time inside a hospital. And I think as for working with kids, I just have always been drawn to kids. I think that it's a lot more fun working with them. Not that adults is not, but just a little bit more exciting,
Sure.
Play games with them and stuff. But Robert has a little bit more experience in both fields. So.
Yeah. Actually, believe it or not, it was my mom as well that got me into it. But before that, I actually wanted to be an architect, but that's more on something else. After telling her what it was I wanted to do, she steered me into the direction of nursing. She said, it's a better fit for you, seeing how your personality is, everything would just flow well. And I said, okay, well, I'll give it a shot. Took years, but yeah, I gave it a shot. And after seeing it just over time, I'm like, you know what? This actually was a better fit for me, but it was through the schooling. And pretty much just tell the stories through my mom of what it was I do. And I actually, like she said, did work in adults first. I didn't want to work with kids in the beginning because I was actually more terrified of the kids than adults. I built more rapport with adults than I did with the kids. But then
he was always scared of like families.
Parents.
I was like, you have the perfect personality for kids. Like you're the one who makes them laugh all the time. Like I knew that would be the best fit.
So then next thing you know, I said, all right, I'll give it a shot. Stopped working with adults, transitioned over to kids. After literally a week of working with kids, I looked at Katrina and I was like, oh my God, this is the best. Oh my God.
He was like, I'm never going back.
I'm never going back because I get to joke with the kids, become a kid with them, do things that with adults, they would just look at me and say, no, this isn't going to fly by. Get me another nurse.
That's funny.
There's a better life out there.
Awesome. So you guys talked about going to school together. Is that correct?
Mm-hmm.
Yes.
Yeah.
Yeah, actually, that's actually how we met too, was through schooling.
It's funny because we both went to Cal State Long Beach originally, but we didn't know each other then. And then fast forward 3 years later, for him at least, or 4 years later, we both ended up at West Coast University, and that's actually where we met.
Awesome.
Yeah.
Awesome.
So
That's
we
cool.
started dating towards the end of it, probably how we graduated.
Yeah,
Long
pretty
nights of studying together.
Just long nights, eating coffee. I think there was sleep in the middle of nursing school, maybe, but it was just repetitive, and we helped each other get through it.
Awesome. Awesome. What a cool story, and what an awesome field where you guys both to get to do this together. That's amazing.
Yeah.
Awesome.
Yeah.
And then to be on the same schedule with all that stuff, definitely pros.
How cool.
Lots of
How cool. So you talked about the different areas that you work in and your specialties. Can you give us a little bit more information on each of your specialties and what population you work with?
Okay, yeah, because mine is pretty general to the point where we would have kids with, as the unit would be, like an acute condition. For example, someone with an appendix just so happens to be swollen, inflamed, or to actually burst. They come in for surgery, and then after a few days of just therapy, antibiotics, and just care, bedside care, they would go home. We do also get situations where we have kids with chronic issues, but they're coming in. For example, we would have a kid who has a tube, pretty much a gastric tube. It's pretty much a tube sticking out of their body. It's to help them with feeds. For example, some kids that are not able to eat or swallow. They've had this condition, a stomach condition, for so long, all of a sudden something I guess you can say acute happens, where they're not tolerating their food. They're throwing up, having diarrhea, just something wasn't mixing. We would get kids generally in the mix of that. Also kids that got, like, let's say motorcycle accidents, car accidents, something that bone fractures. It's really broad.
Gotcha.
Yeah.
And then my unit is a little more specific. So we get patients with all sorts of blood disorders. So it could be like sickle cell or just regular like anemia. And then we also get people with cancers, like different types of leukemia. That's really common in our patients. And also at my hospital, we focus on like bone marrow transplants. So it's one of the few in the U.S. actually that will take pediatric like bone marrow transplants.
Oh, wow.
So those kids are in our hospital for like months at a time.
Wow.
So actually with most cancers, our patients are not generally like in the hospital forever through their treatment. It's more so they come here, they get diagnosed, and usually diagnosis for pediatric patients happens on accident, you know?
Oh.
A kid comes in and all of a sudden, like, their leg's been hurting. We don't know why their leg's hurting. Then they come in, they get some tests done, and all of a sudden, you know, we get someone who has osteosarcoma, which is like a cancer of the bone. And so honestly, it's almost one of those things where you're kind of glad that the accident happened in a way, because then now you were able to figure out that there's something wrong.
Yeah.
So we have patients like that that'll be there just for diagnosis. Then they start getting some initial treatment in the hospital. Then they can go to clinic, which is like pretty much getting your medication like outpatient. And they can come in and out. And it's just when they get really sick for whatever reason, then now they're coming into the hospital and spending a little more time. But yeah, as for my patients, they're more chronic. It's more of life is just different after that. Whereas Robert's patients are kind of in and out, you know?
Gotcha. Yeah. Wow. So quite a diversity between both of your patients that you see. And, you know, we've talked about this a little bit. My experience having diabetes, and as a therapist, I work with families and children with chronic illness. So actually both of your areas, there's a lot of patients that we would probably cross treat. with people going in for treatment for appendicitis, or a lot of pediatric patients that are experiencing or adjusting to the new diagnosis with oncology or a form of cancer. What kind of correlation do you see with mental health, like as far as treatment and coping skills, and the medical treatment as far as their prognosis and them getting better?
The number one thing that I've seen in terms of correlation, like the mind actually does play a huge role in the recovering process. Give you an example. Not too long ago, I've had with my my patients. I've had two patients coming in for the same situation. Pretty much their appendix has burst, both of them. They're both of the same age, coming in for the same reason, and they got treated with the same type of surgery. Appendix removed. And the number one thing that we've been telling our kids to do is you got to get out of bed and walk. And with that in mind, sure, it's the kid who, by the way, like let's say 8 years old, both of them 8. Because of the pain, they're not going to be as motivated to get out of bed, which is perfectly understandable. But with the help of parents and nurses, just encouraging them, saying, hey, you can do it, just get out of bed. We'll walk, we'll make a game out of it. Let's see how many steps you can take. Let's see if you can get some more coloring supplies from our station and back into the room. Something to help them get out of bed. Pretty much the main thing I was going to get at was I've had, let's say, patient A. Mom was helping her get out of bed, staying motivated, ends up staying for just 1 week because of how much encouragement she was getting, just helping her walk. Patient B ended up staying a week longer, maybe a week and a half longer, if I'm remembering right. But that's because based on what I was seeing, and I've had that same patient every single time, I've been trying, the mom would stay on the sofa bed. The kiddo just stays in bed the entire time, not even wanting to move. To give you an idea, I just wanted to check her blood pressure, doesn't even want to get touched. Doesn't even want us to take a look to see if the stomach is distended, if it's inflamed, if it's firm. Just wanting to make sure. No, there was nothing. And pretty much because of that, I saw that it was just taking a lot longer than it should.
And to step off of that too, I've kind of had experiences similar, but also this is kind of what drew me into this specialty. Is when I was in school, I actually had experience on an oncology floor. And I really loved that, yes, these are patients that have to kind of change their lifestyle. And I liked that there was a lot of family involvement. And I think that helping kids cope too, because since we do work with kids, you know, some of them are like 1 or 2, like they don't understand. They don't understand what's going on. They just know they don't feel well, you know? So I think that a lot of the recovery also depends on not only the kids coping, but also the family. It takes a lot of education for patients and families to feel comfortable with what's going on, to encourage all of them that the kids need to feel the support from their parents. If the parents kind of, you know, the patients can feel that their parents are so anxious or they're not like encouraging them to get better because they feel helpless as well, then that definitely has an effect on the kids' prognosis.
Yeah, because kids, the way I've been told is like kids are like sponges. Whatever they see and feel, they're going to absorb and they're going to pretty much reflect that off. If mom is very encouraging, you can expect it from the kid. If the mom is just sitting down, not doing anything to help her child, what do you think is going to happen with the child? The child's not going to want to do anything at all because the parent is not doing anything at all.
Wow.
So involvement is really a huge thing, especially with mental health.
Yeah, but I've also thought that, you know, like the reason why, like I always get it when people hear that I work an oncology floor, they're like, oh, that's so sad, you know? But I think that the reason why I don't feel that it's as sad is because feel like kids are so much more resilient, you know, like how many times as an adult or something happens to us and it's like, ow, that hurts. But like you see kids all the time falling in the playground and they just get right back up because they want to play because their other friends like running off, you know, like kids have so much more drive to just get back up, you know, and I think that's also what's really sad on our unit is when you see someone who's kind of just, you know, shut down, and you can tell the difference. And like it's also a lot harder to get like our teenagers to start getting up and wanting to go out because they just feel like their life is over, you know, as opposed to the little ones, they just want to play their game. They're like getting their chemo, like playing on their iPad, like not a care in the world. Like, just tell me when it's done so I can go play.
That's all they care about.
Yeah, they're like, when's
They're
the
so
playroom open? Like they don't even care. But like teenagers are like, oh, like none of my friends can come here.
Oh, yeah. Those are some great points that you guys bring up. You know, I like the correlation with the support externally from parents and the resilience factor. So you mentioned like teenagers and kind of almost sticking in that kind of negative, more hopeless perspective. What do you guys do as nurses to counter that and help them?
What I've tend to do, and it goes well with adults, is first thing a nurse would do is obviously assess. The first thing I would do is look at him, see is there anything I can pick up on him to relate. For example, one of the teenagers that I had a Nintendo Switch, and you can tell on the look on his face, he was just moping, just didn't want to do anything, and he wasn't even enjoying the game. But then after I picked up on it, I started talking to him, hey, have you played Zelda? Have you played this, Metro Prime? Anything just to pick up on it. Other kids would be like seeing it on their t-shirt that they love the Big Bang Theory. It's like, hey, I love characters in the Big Bang Theory. Tell me something about it. Just something to engage them in. Just casual conversation. Just small conversations can really take on a long way.
Yeah, and bringing like some sort of normalcy into the hospital. So yes, it's like your friends aren't able to come into the hospital, but that like for like our teenage boys, they love their Xbox, you know, or their PlayStation or something. It's like, bring it in. You can hook it up in your room and you can play it here and you can play with your friends online, and like that also helps a lot of our like teenage boys, like they're super into that.
Nice.
Just encouraging them, or like Robert said, bringing up certain conversations, like trying to be their friend, because I think a lot of times too, when we try and bring in like a psych consult or like a neuropsych consult or things like that, like sometimes, you know, teenagers get a little bit more embarrassed or shy. So I think it helps as nurses to be that person to them, because they're not expecting that, you know. But if you could just be a friend to them and be that person they could talk to, or like find things that you may have in common with them too, like TV shows or it definitely helps too.
Yeah. This is a main component that we share professionally. You know, it's all about the rapport, building that relationship, and that's exactly what you guys are describing, is building a relationship with your patients. You know, I remember when I was diagnosed, I was 9 turning 10 when I was diagnosed with diabetes, and I was going into a coma. And I remember the relationships that the nurses and I built, and they were very encouraging. They would ask me about like what shows I would like and what movies I'd want to watch. And they would bring in the little wheel cart TV so that way I could watch movies while I was in the hospital. And yeah, it makes a big difference. And, you know, ultimately with a big life-changing event is just helping me to cope with those adjustments. So you guys mentioned a few examples, but what do you find helpful related to coping strategies or coping skills that you use yourselves or that you would recommend for your patients just to overall improve the prognosis and their treatment?
Well, what I've tend to do, like for example, with my patients, what I love to do with my patients is I would ask them, hey, I tend to do magic. And just to let you know, like, if you don't want to see it, it's perfectly fine. But do you love magic? I'm not even 9 out of 10 responses. I say 9 out of 10 because there was that one. But 9 out of 10, they were like, yes, oh my gosh, I love magic. And just the look on their face from when I started shift, just completely out of it. They don't want to be here at all. Just smiles and just something to look forward to. They're like, yes, oh my gosh, I want to see some magic. Like not too long ago, I had a kid who has to stay up for, well, let's just put it this way. They had only 4 hours of sleep. They could only sleep from 2 to 6 for, they call it the sleep deprivation test. They're trying to induce a seizure pretty much, just so that way they could figure out which part of the brain and which medications, but that's just something completely on the side. But the look on his face when he realized, man, I have to stay awake. I'm not going to be able to sleep. This just sucks. I would throw him certain options like, hey, we got some things we can watch on the TV. We have video games if you'd like to play. We got board games in the station. We can even chit chat. And I see that you have certain things that you like. Now, to keep them going, I would say, all right, I have another option. I do magic, and I can show you a trick or two every hour just to help you stay up, just to give you something to look forward to, I guess, like a little performance. And majority of the time, they'll be like, oh my gosh, yes, I'm so down. And the parents who are sitting down immediately get up too. No matter what language, they immediately know, like, magic, as soon as they see a deck of cards, like, magic, it's like, yes, I'm going to show you all magic. So that's what I tend to do, is just show them a few card tricks, coin tricks, or rubber band tricks. Just something to
Robert
keep them
has
going.
more of the tricks. I just good at talking sometimes. playing card games with them, stuff like that. Learning TikTok dances with them.
Nice. Awesome. I love it. These are great examples. And, you know, ultimately it does. It has an impact on our mental health and our coping. And you guys see increase in prognosis, like they're doing better based off of these skills that you're providing?
Oh
Yes,
yeah,
without a doubt.
definitely. Like I've told him a story about like I remember having this one girl, and you could just tell, so she had relapsed, and you could just tell that she had been so beaten down after finding out that she had relapsed. And something just felt different this time. And so we just tried to find ways to get her to keep going. She used to be so optimistic all the time and always just saying like, I can do it, I can do it, I can do it. And then all of a sudden after this relapse, she was just beaten down. But on the days where we could get her to dance in her room, on the days we would play High School Musical in the room and start singing, like it's all of a sudden like yesterday she had 5 doses of morphine. Today she had 1. You know, because we got her to get up and dance, you know, like it's just all about changing the mood of the room. If we let you sit there, obviously there are days when you're just not feeling it, but if we let you just sit there and sulk, it just gets worse, you know, but if we find ways of distraction, it can at least lessen the pain a little bit, you know?
Yeah. Definitely had kids just like that too, where they needed a pain med, but just distracting them with cartoons or video games or even just chit-chatting and just playing with little toys.
Yeah, like you can't get up, but we can make you laugh, and that at least helps a little bit.
It really does forget about the pain or the reason why they're there. Some kids I've had, even adults, they even like said, gosh, for just a brief moment, just for like a minute, I totally forgot I was in a hospital. And I was like, oh, wow, this was with adults and with kids. I was like, you know, it's actually really good. You know, the fact that you feel comfortable enough to say that you're not in this strange place, you're in somewhere comfortable where we can help you. Yeah.
Wow. You know, this stuff, these examples just warm my heart. You guys are doing amazing work. So definitely thank you from me for all that you guys are doing for your patients. I mean, it just shows with the examples you're giving and the stories you're telling that you're truly passionate about this and you're doing amazing work for people. So thank you so much for that. Would you have any recommendations for patients, or maybe even the people that will be viewing this video, of encouragement or for ways for them to cope if they end up in a hospital where you two aren't there?
Well, first, the number one thing I would highly recommend is, especially for kids, is parents, you have to be strong. Because the moment they sense something is off and they're looking at you, because they look up to you out of everyone else, not even doctors. They don't know what doctors are. They don't know what nurses are. They know mom and dad, or sometimes grandma, grandpa. The moment they see you just being strong, having a smile, and just encouraging them, they will feel better. That's the number one thing I would recommend out of anything else. Number two, today's day and age, just in case as a backup, parents have a phone, because that's what kids are always all about these days. Their tablet, phone, just something. And if you have a phone and you're like, I don't want to do it, get a phone case. Get a big phone case and then wrap that in saran wrap or bubble wrapping or whatever, and just give it to them, just so that way they can distract their mind. Anything to help distract.
But also if you are even an adult who ends up in the hospital, whatever, I think don't think of being in the hospital as a disconnection from the world. There are so many ways to still be involved with the rest of the world through technology. Like that's like, even as an adult, being on your iPad or whatever, like being able to still talk to your friends, your family, having all that support on the outside world makes you feel a little less like you're in a hospital.
Yeah.
Touching up on that is, like for the adults, even if you can't touch with the outside world, keep in mind you're in a place where you're meeting totally different people. You can take that opportunity to get to know other people too, especially even if you're behind a curtain. You can, if they allow it, you can get to know the person sitting next to you, and you guys can help each other out. If you have, as you can say, a roommate, there are ways to communicate with people, help distract, just talk.
Even our patients' parents who end up becoming friends because they're just next door, and they're like, you know what, we're both kind of going through the same thing.
Wow.
Like,
yeah.
they support each other, and therefore their kids get the support that they need because the parents feel better.
Yeah, and I can guarantee you, no matter where you go, there's always a staff member or staff members.
Someone who cares.
There are people that care enough to sit down and just talk to you for a few minutes. I can't speak on the behalf of everyone else, but I've had moments for myself where I know all my kiddos are fine, but I have a kiddo here who is in distress. I'm going to sit down with him, take a few minutes, just say, hey, you can talk to me. You're in a safe place. Just let me know what it is you're feeling. How are you feeling? Is there anything I could do just to give you a little bit of a smile, just a little smile? And then that's a great conversation starter right there. So just talk. Yeah.
I love it. These are great recommendations. Thank you so much. Like this is all amazing, and I think great material for our viewers to take in and just be aware of. I do want to go back to something that you mentioned earlier, though, because I seen you hold up a deck of cards and you mentioned magic. Do you happen to have any examples for us?
Yes, I do, actually.
You want his whole book of magic?
Oh! So what I usually tell the kiddos is, or even adults for this matter, is I would look at them and say, red or blue. Look at me, what? What are you talking about? So Gabe, red or blue?
Blue.
Blue. It just so happens I have a blue deck of cards here. It just so happens. Well, the thing is, I don't have any red. I don't have any red cards with me, but we'll do this. Okay. So we got our standard deck of cards right here, okay? Now, what's going to happen here? Ooh, I'm getting nervous. Now, I always tell the kids this, like, no matter what, because they're looking at me like, oh my gosh, is he going to do it? I'm like, yeah, give me a second, because my heart rate skyrocket. It tends to skyrocket. So give me a brief moment. Let's see. if I could do this right. Ooh, I'm standing. Okay. So they call this one the time machine, right? Ooh, I'm getting nervous right now. Okay, so I want you to memorize this card right here. You see that?
Yep.
10 of diamonds, right? So you got the 10 of diamonds right here, and it's gonna go forward in time, forward in time, forward in time, right? You memorized that card, correct?
Mm-hmm.
Now, 10 of diamonds right there. Now there is a second card I want you to memorize. If you can see that well, you got the king of spades, all right? Now the king of spades is gonna go back in time, back in time, back in time, back in time. Now, if done correctly, this card, do you remember what the first card was?
Mm-hmm.
If you can say it for the audience, please.
10 of diamonds.
10 of diamonds. That 10 of diamonds should have, in fact, come back, and the king has never left. Right? Now, you mentioned to me blue.
Mm-hmm.
Right? Now, typically, I would ask the family to pick a deck of cards or pick a card, but for the sake of this, I'll have her pick one, and then she's going to show the camera. I'm not going to look. I'm actually going to tell her.
Ooh, can you see it?
Mm-hmm. Mm-hmm.
Now, she's going to put it right on top, okay? Just like that. Now, sometimes some kids would say they want red, right? But then I would be like, oh, I'm so sorry, all I have is blue. But you know what? You're actually a magician yourself. I noticed you're wearing a red shirt, so I'm just going to touch the screen real quick, grabbed a little bit of red, just going to rub it on there. And I look at the kid and I said, hey, can you snap for me one time? And you can see them like they're really trying to snap, really trying. And the next thing you know, the mom will be like, ay, mija, there you go. And I'll be like, all right, perfect. Now, notice, the card should change color. Oh, the suspense. Well, there you go. It just so happens to be right there. Now, again, for my sake, I want to know what was the card that you picked, or technically Katrina. You can say it out loud.
2 hearts.
2 of hearts. Is this in fact the 2 of hearts?
It is.
Now, what we're going to do here is give that 2 of hearts, hold it just like that. Okay? So I'm show the camera. What's going to happen here is I want you to tell me when to stop.
Stop.
Stop. I want you to memorize this card. I'm not going to look. Can you see that okay, Gabe?
Yep.
Perfect. Okay. So I said, all right, we're going to do this a second time, because some people don't think I can do it a second time. You see that nurse over there? I usually point at a nurse. She doesn't think I can do it. Let's prove them wrong. All right, I'm going to grab that red again on your shirt, just like that. Go. All right. Go ahead and snap your fingers. Kiddo snaps his fingers. Oh, perfect. Go like this. Then all of a sudden, it should turn red. Oh, dude, I don't know if I set this one up right. Hold on, sorry. What was the card?
10 of hearts.
10 of hearts. Now, the 2 of hearts has indeed, in fact, turned to the 10 of hearts.
See, I'm even confused.
What?
And I got confused. I was holding it the whole time, like, wait.
So then, to finish it off, I usually show them this other trick. All right, so.
You're getting a whole show.
Yeah, pretty much.
Love it.
All right. I want them to, we'll use the jack, right? We'll do this. Can you see that, Jack?
Mm-hmm.
You can see it okay, right?
Yeah.
Now, watch closely, okay? The jack goes inside the middle of the jack. I give it to the kiddo. He holds in his hand. And I said, I want you to shake it for me real quick. So obviously they shake it really aggressively. I'm like, did you notice anything different? The kid goes, no. I'll be like, the jack actually climbed up. He goes, no. Picks it up. It actually is on top. So those are just like a few examples of the card tricks I show the kids just to help them stay distracted, or even the parents, because some of the parents, they would have, they would have the looks on their faces like, oh my gosh, my kiddo's here. What do we do?
And all of a sudden, they didn't even notice you were putting medicine in their little tube.
Just to help them, just to help them distract, or even checking their blood pressure. They're distracted on this, not even realizing that their blood pressure is being taken. Believe it or not, a lot of kids don't like the blood pressure cuff. It just has that squeezing effect on them. But if you can distract them just for a little bit, get them engaged, show them magic. I'm not saying everyone should do magic, but if you can, if you want to, do it, but you don't have to. But just anything to help distract the mind really does help.
Wow, I love it. How amazing! Everything that you guys talked about in this video, I'm still captivated by the magic.
Yes.
I got my own coping skills for today. It was amazing. Yeah, it was amazing. Wow. Thank you both so much for what you do for our community, for the world, just helping other people with your roles. Thank you so much. It's just incredible, and I appreciate everything you guys shared today. Thank you so much for taking time out to meet with me via Zoom and do this interview. Once again, everybody, thank you to Robert and Katrina.
Yeah,
Thank you.
Thank you.